Welcome, everyone, to this episode of the NLN podcast, Nursing Edge Unscripted, the scholarship track. I'm Dr. Sue Fernaris, Director of the Division for Innovation and Education Excellence at the National League for Nursing in Washington, D.C. Our unscripted conversation track entitled Scholarship celebrates the published work of select nurse educators from the NLN's official journal, Nursing Education Perspectives. These conversations are meant to embrace the author's unique perspectives on teaching and learning innovations and the implications for nursing program development enhancement. This episode is entitled Socrates and Online Learning. And we're going to focus on the unique perspectives of Dr. Robin Dewald, who is faculty and program director at Excelsior College School of Nursing in Albany, New York. Welcome, Dr. Dewald.
Thank you.
So you wrote an article in Nursing Education Perspectives that was published in July-August 2020, and it was entitled, How Would Socrates Enhance Online Learning in Nursing Education? And I am really, as I think about it, what a bravo time for it to be published, especially in the midst of faculty having had to have pivoted last spring and looking to move into online learning in the fall of 2020. So really timely. And I appreciated that. And as I began to read through the article, what struck me initially with the title was Socrates, and sometimes Socrates, is misinterpreted, and I always thought, so why Socrates? And I'm wondering if you want to talk a little bit about your thoughts on, why Socrates and a little bit about that approach.
Sure. And I don't know if Socrates was misinterpreted, but maybe just misunderstood.
Misunderstood. Absolutely. Yes.
And I've always asked questions. I've kind of been taught to ask questions. We're taught that in nursing, to ask questions, find out different ways of doing things, find out what's really the problem with maybe one of your patients or a family or whatever, or your students. Socrates believed in the power of knowledge. He was someone who would seek knowledge through all different methods. He spent a large amount of time seeking meanings of his life and other people's lives. He was a renowned deep thinker, lover of skepticism, and his questions were really on daily issues in human life. And that's what nurses do.
Yeah.
Socrates believed in governments, that they should be ruled by people with knowledge and the ability to understand themselves, not just other people. He was always seeking to find rational and mathematical answers to find solutions about nature, but it was always with reason and logic. And think about nursing. That's what we do.
Oh, absolutely. All the time. And, I appreciate your comment about the difference between misinterpreted and misunderstood. He did ask a lot of questions and, and many times it may be how he asked the question as we think about asking questions, of our learners to get them to think about their thinking as a means of, because he was a deep thinker, as you mentioned.
Right. And it was also, some of the content was, unacceptable. He wanted people to believe in themselves, and maybe back then that really wasn't the right thing to do. Right?
Well, and today, I think it's hard when we talk about, faculty seem to be somewhat stymied over, well, how do we engage our learners? Well, engage them to think about their thinking and to kind of set a tone that Socrates might have that was a query into, I'm curious how you see this. I think about it this way, and I think too often we forget the value of that as we think about our own practice in nursing and our own work as educators, the time that we do spend thinking about our own thinking on topics.
And we have to do that. We have to do it as educators and teach our students to do that.
Yeah, that role modeling piece.
Right. And like as nurses, he taught us to question everything. He taught us to assume nothing, scrutinize everything. And what's interesting is that he gave us a system to do that.
Mm-hmm. Yeah.
It's the scientific method.
Yeah. Yeah.
Basically, that was formed out of Socrates. And we do that in nursing, all healthcare, pretty much anything with any kind of studying.
Yeah.
What I really liked about him, and it really hits home with, is he thought life had little worth without happiness.
Oh, say that again.
He thought life had little worth without happiness.
Oh.
When you think about it, yeah, right? We need to take a step back and foster an awareness for our world and develop a mindful connection with our lives, which is basically popular right now with mindfulness.
Yeah.
Okay?
Yeah.
It's nothing new. It's nothing new at all.
Well, and that it kind of sheds a different idea on this notion of happiness, define happiness, energized by things, a sense of purpose, all of that, can bring to mind a different rationale for the question.
Right. And happiness is personal, and we're going to define it completely differently. Because happiness to me is not going to be the same as for you.
Absolutely. Yeah. There was a piece in the article that was a citation from George back 2015, where you shared that there was a purpose of questioning, that it was rather than an explanation, that when we question, it's a gift to promote interaction. And the methods used to teach and nurture curiosity and engagement in learning involve much more than just asking and answering questions. And so when people talk about Socrates and questioning, it's really more than that. And I loved these sentences because I think it really gets at the heart of differentiating monologue, which we often find ourselves doing in the classroom, versus a dialogue. And I'm wondering, how do you see this?
Well, there was a couple different questions in that. How you ask a question really matters. So if you want a factual answer, then you ask it in a way that elaborates on that. If you want a feeling type, you have to ask the right question. And in the article, it gave some examples of how that, and they have to be purposeful questions to get a purposeful learning response.
Yeah. The how, you talked about that. That is so important, how you ask the question.
How you ask it. And, people say, I'm a strong believer in the purposeful pause. How do you do that online? It's not hard. You say to the student, wait a minute, stop, think about this. You can type that in. And you say, put it down for an hour, then come back. You have created a purposeful pause. It's not hard. In a face-to-face, I could just go, can't do that online. No.
Well, the other thing too is that it gets at this notion of silence, the use of silence, the purposeful pause, and sometimes our own discomfort with silence. And many times as educators, an educator may take silence as, oh, was it something I said? And so immediately comes on the defense about, whereas the learner needs time to process sometimes. And do we give them that time to do that? I remember them talking about a study with medical students who follow their professors around in their clinical practice and the rapid fire questioning that goes on. And when they studied that, realized that the professor was only giving them 1 or 2 seconds with which to spew out the answers. And when you think about thinking, really, is that enough time for some learners to process?
And it's usually not. And you want them to connect the dots, and you lead them to connect the dots, but they have to stop and process.
Yeah.
You got to bake the up. Put it in the oven and bake it. And if an instructor feels awkward doing that, tell them, I want you to stop and think about this. And then that discomfort goes away.
Yeah. Yeah, very, very important.
Okay. And you brought up the monologue thing because
Yeah.
basically that is the lecture method. Okay. It is a monologue. Students are taking notes, you're up at the podium and they listen, listen, listen. Some people are probably doing crossword puzzles. You know, you don't really know what they're doing. They just look like they're taking notes. So monologues, I don't think work well, except it depends on, like, take for instance, Hamlet's To Be or Not to Be. It was a monologue in a way, but it was more a soliloquy because he was having a conversation with himself. Okay, so it was a conversation with himself, but it was about expressing his feelings. He was questioning himself, and he connected with the audience. So that was a good way to do it. So it was almost like an out loud reflective journal, right?
Well,
Okay.
and it's short. I mean, I think part of it is too, is how long can you go on? I mean, if you think of some of the latest neuroscience research, it's that chunk, 10 minutes of information is about all that people can absorb before you need to get them to begin to process it a bit.
Right. Do something with it. But so a dialogue, I mean, mono is one, dialogue is two, but it's really or more. It's a conversation. So there's an interaction between and among individuals. It promotes curiosity, it promotes engagement. Storytelling is a great way to do this. Okay, ask the students to tell a story. I mean, if they, after a clinical experience, they tell me what happened. What was the crisis? What did you do about it? And how did it end? It's just basic storytelling. They can share their stories. They can ask and answer questions. And I want students to ask questions too, because that's part of the process of being a nurse, is asking questions, listening intently on the answers, and responding. They can provide examples with analogies, metaphors, and it all leads to higher level thinking, higher level learning, and higher level understanding.
Sure, absolutely. A lot of the conversation in the article is also this notion about thinking, and that the questions you ask drive that thinking. So you discuss some key ideas from Paul and Elder on the foundations for critical thinking, and I'm curious to have you share a little bit about how their work informs these Socratic strategies.
And we kind of touched on this, but I'll go a little bit deeper now because the National Council of State Board of Nursing pointed out that there's 3 areas where newly licensed nurses had issues. That was clinical judgment, professional communications, and active listening. So how you ask a question depends on the level of the learner, the purpose of the learning, and how they've gone through scaffolded through each process. So when you're thinking at a new nurse, you're going to start more at the fact level. They're not going to be able to connect the dots yet, but you're going to, in this process, teach them to do that. So depending on the learning situation, you want to lead towards clinical judgment. So first, they have to recognize the cues. So what are those cues? These are the questions that are factual. For example, what's normal or abnormal values, okay? And what's the immediate concern with this patient or this situation? Okay, so that's the factual and the cues. So they have to be able to see them, hear them, smell them, and the questions are related to that. You go into and say, what smells funny in this room? Okay, those are the cues that a nurse needs to know, but that's actually lowest level, okay? The next level is the analysis. Okay, at this level, they build on the previous stage with the cues, but they're more analytical. So for example, what pathophysiology relates to the lab values presented? Okay, what are the potential complications? What other issues might influence your client's health? So you can go back to this and what smells funny in this room? And you say, it smells kind of disgusting, right? You say, okay, well, what could that mean? he hasn't had a shower in a while, something spilled on the floor, his uncle's here and he doesn't smell good, all those things. What you analyze what the issue is. So that's like level 2. So after analysis, students need to prioritize and hypothesize. So this is mid-level analysis, okay? What kind of questions would you ask with this? What's the highest priority for your client or patient right now? What other needs does your patient have? What else might be going on? And what's most important at this time for your patient? So that's all nice and good, but then they need to generate solutions. Okay, so that's the 4th level. This is, I call it the what if stage. Okay, I love what if questions. Okay, questions that generate solutions might be, what interventions are needed to address your client's needs? What influences the appropriateness of the intervention? What are the potential complications? How could you minimize the complications? Explain the best case scenario for your client. Explain your rationale. And of course, what if, right?
Exactly. What if you changed an element in the situation, or change the age of the patient, or change those variables to get them further along?
And it could even be with like medication management, what happens when you forgot this medication? Okay, those are the things that actually really happen in real life. What would happen if this happened? What would be the worst case scenario? What would be the best case? And what would you do about it? Okay, those are the things that happen that nursing students need to be asked.
Yeah. You made a comment earlier about connecting the dots at that they need that time to begin to take data dots and link them together to form valuable information. And I know I'm often think about working with learners in the sense that I'm not so necessarily always wanting them to have the right answer. I'm more curious about how they got there, because sometimes, we rely too much on an answer to inform us about learning, when that answer and that, may be fine given that context, but the pathway that the learner took to get there might completely mess them up in a different situation.
And I agree. And I tell my students that all the time. You don't have to be right. It's okay to make a mistake. Let's talk about it. I would say, you're in nursing school. You're not a nurse yet. So it's okay to make mistakes. Let's work it through and share your mistakes with your fellow students.
Absolutely.
So we can learn from each other.
Yeah.
I never tell, these people that, especially online, they write these mini papers and they answer these questions like, they're PhDs. Lighten up, right?
Are the ones where it covers the waterfront, and then you begin to wonder, well, did you really know, or are you just including everything to make sure you get the right answer in there at some point?
But part of that, and I'm kind of going to diverse a little bit out of here, but part of it is what we ask the question, like the discussion question. How you ask it and what you ask determines the mini paper. So you have to stop and say, what do I really want the students to get out of this?
Exactly.
Okay. So relook at your questions before you get a response and you get these 12 pages of what you really didn't want in the first place.
Right, absolutely. There was a piece in the article that I thought was really important, that is a brilliant insight into Socratic questioning around critical reflection and cultural sensitivity. And there was an article in 2018 by Koss and Williams that you mentioned, that educators must have the knowledge and skills to recognize and address social issues related to discrimination and oppression. And they promoted using the Socratic method as an effective and valuable tool. And I was really taken by that, because, especially as you think about diversity and inclusivity issues being front and center right now in our society, in your work as an online educator, How has Socrates and the strategies impacted how you, address diversity?
Yeah, it is important, and cultural sensitivity and reflexivity is so important to me. Um, and online, students they can feel like they're anonymous, so they can actually feel safer answering questions and talking about this. But of course, it has the opposite effect too, where people feel safe saying things they shouldn't say. So online, you have to be very
Sure.
careful, so safety is not always safe, right?
Yeah.
So you just have to model and make sure the netiquette occurs. And if it doesn't, you take down that discussion and you contact the student.
Yeah.
I've only seen it once or twice in my career, but when it happens, it's pretty cruel. But back to the critical self-reflection, what's difference about self-reflection and critical self-reflection is critical self-reflection is not done in a vacuum. So there's questions and there's conversations regarding that. Okay.
Right.
The reflective journal is private and they can do all the stuff. The instructors might be the only one to see it. If an instructor sees it at all, it doesn't really know. So it's not done in a vacuum. And this is where you bring up those difficult questions.
Mm-hmm.
How you ask them matters. But relating it to feelings more than content, like asking your students, how would you feel if that happened to you? Or what can you do to create change? Okay, instead of choosing a certain vulnerable population and painting a picture that maybe they don't have that picture.
Right.
Right, at all. So I would put it to the feeling part or the action part.
Yeah.
Okay.
It's tempting to have them understand that perspective by putting it. Yeah, I love that. How does this make you feel?
And that's how you have to do it. But the action part is also important. And I didn't really finish this, but I'm just going to add to the final stage of getting to clinical judgment is taking action.
Oh, sure.
How will you, what were you going to do? I mean, what's your priority action? Who needs to be involved? They talked about communication is a difficult thing for new nurses. The asking questions and asking student to ask questions not only improves clinical judgment and communication with staff, but also active listening, which are so important in nursing.
Yeah. And we teach, it's really, in a way, as faculty, role modeling some of the behaviors that we teach in good communication with patients and transferring that, to our use with our learners so that we are role modeling it all the time.
Exactly.
Yeah, so important.
Okay. And as they progress through the program, they'll have more confidence in asking questions.
Absolutely. And not feel as though they're being pushed to not for fear they're going to be placed on, defensive posture. And I think it's so important, with that active listening piece and the role modeling and the encouraging that they begin to get comfortable, with that question dialogue. Absolutely. So really a timely article. And I know, that as we emphasize in engaging learners online and in the classroom, and this use of kind of the buzzword active learning teaching, which is really about how are we meeting our learners where we're at to, give them the biggest bang so that they take away something from every encounter, and that it's the right thing they're taking away because we were planful and engaged them. What top 2 tips would you have for our nursing faculty colleagues as they begin to embark on Socratic questioning?
So you're limiting me to 2, huh?
Oh, okay, 2 plus.
It's okay. Well, you're right. Engagement is the key to successful learning. Okay. Using Socratic questioning leads to engagement. It does this you ask your students to dig a little bit deeper, okay? And not a lot at one time. So what does that mean in this situation is a question. And you make connections between and among the course content, and then between and among the students. Right. So in an online course, they will see each other, but you can say, hey, Sarah, John said something similar to that. Or you can say, hey, Sarah, John contradicted you with this, and bring the conversation together. You can also kind of blanket a conversation, say, hey, class, think about this. So you don't have to do this constantly with every student, because then students feel like they have to answer or else they're going to get in trouble. So blanket it so you don't overwhelm them with questions.
Yeah.
Right. And the students, they share stories. They actually kind of can struggle together to find different points of view or discover the facts, depending on what your questions are. So the first tips, I'd probably say that practice makes perfect. Start small. Know your curriculum, the course content. Know what the learning outcomes or objectives are, and know the content. Okay. So what are those outcomes? What do I want the students to learn in this course? Then you consider the questions and the teaching methodology. It's not just questions. We talked about this a few minutes ago. They might be watching a video and then they have to ask each other questions related to that, based on the vulnerable population that it showed or whatever. So that's a different methodology. It's not just throwing out questions.
I love the fact that you mentioned this notion of learning outcomes, because how many faculty actually come to a class with class learning outcomes or a lesson plan that's sort of meant to guide your whole learning encounter with those learners. So important.
Yeah, you need the outcomes. If you don't have a learning outcome, what are you teaching?
Exactly.
And what's the purpose?
And the PowerPoint, as I often say, is not your lesson plan. So
exactly. It's not. Anyway. It's not. You have to know what the students are expected to learn from this time you spent with them.
Yeah.
Okay. So, and then the students also need to know why they're learning it. Tell them why you're connecting the dots for them, and then they learn to connect it themselves. So connect with life, with learning, their clinical judgment, and always bring in cultural sensitivity. No matter what, you can thread it through somewhere, always.
Absolutely.
Okay.
Always.
So my second pearl was wisdom. I really like, by the way. The 5 rights of medication administration, right? Well, there should be 5 rights of Socratic questioning.
Oh.
All right. So be sure to ask, was this the right student? The right question at the right time, that's readiness, for the right purpose and in the right situation. So the right student, the right question, the right time, the right purpose, and the right situation.
Excellent. Wow. I like that one. Some rights for educators to keep in mind. So thank you, Robin, for joining us today. And I know you're writing more and more about the use of Socratic questioning in nursing education, and we look forward to some future publications coming. For those of you who would like to read more about Dr. Dewald's work in Socratic questioning, you can go to the National League for Nursing Education Perspectives Journal, and the publication is in the July-August 2020 edition of NEP. Thank you again, Dr. Dewald, for joining.
It was great. Thank you.